ওর বাচ্চা কাচ্চা বোধহয় আমেরিকায়, আমি শিওর না। ওয়ালাইকুম সালাম জাফর। দুইটা স্ক্রিন আছে তোমার ওখানে?
হ্যাঁ স্যার আছে।
Okay, this is 1 year 2 old, 1 year and 2 month old boy. You can, if you can see, I am trying to palpate. There is no testis in the scrotum, nothing in the inguinal canal, even after general anesthesia. So our decision for laparoscopy is justifiable. So we will go as usual through the supraumbilical ridge. সাকার টিউব কই নিতে হবে তো, এটা তো ল্যাপারোস্কোপি। ওখানে ইয়ে করো তো, ওই যে ব্রাইটনেসটা 3 বার বা 4 বার মাইনাসে চাপ দাও। খেয়াল রাখতে হবে, অনেক লম্বা রাখলে প্রবলেম হয়। ঠিক আছে। So we are now starting with the port placement at the supraumbilical ridge, a stab incision, holding the skin on both sides of the stab. Use the tip of the mosquito forceps to dissect and expose the linea alba, holding the linea alba on each side of the midline, and giving a stab at the linea alba in the midline, and we'll check if we enter into the, it goes into peritoneal cavity. We are not enlarging it with the tip of the mosquito forceps, so that the 5 mm port is held snugly and do not come out during our maneuvering. Considering the age, we will keep 10 millimeter mercury pressure, 2.5 liters per minute, but as it is under general anesthesia, if necessary, we can increase the pressure and flow to 12 and 3 without causing any intraoperative discomfort to the patient. But we will try to avoid that, because the increased pressure will stress the muscle and diaphragm, that will give some post-operative discomfort. Yes, Jafrul. Want to say anything?
No sir, I have understand.
Jafrul, can you hear me?
Yes sir, I can hear you. Sir, I have understand
Okay.
whatever you have said. Sir.
Yeah.
Sir, what you have said, I have understood. What you
What
have
I have
said,
said?
I have understood, sir.
Okay, okay. You can see the right-sided testis, right? Can you see?
Yes, sir.
Jafrul, you see, right?
Yes, yes, sir.
This is the right-sided testis. This is the vas difference. Here are the vessels. On the left side, this is the left side, okay? So what we will do is, we will give another port first and check whether we can bring out the testis without tension. So The second port we are giving at the level of umbilicus a bit laterally on the left side. So now we'll use the Babcock forceps to hold the right sided testis and trying to bring it. You see, it is not coming easily, but I think we can manage. If we divide the gubernaculum here, right? You see the gubernaculum?
Yes, sir.
The in the upper part. If we divide the gubernaculum, then I hope through this route we will be able to bring the testis to the scrotum. The again we will check again. Let me see. I hope we can. If we divide here and here, the vast difference is not a problem with the length. The length of vast difference is always adequate to go down, but the length of testicular vessels are in question sometimes. Little tense, but I will try with this right testis. I hope I can bring out. We are now giving another port on the right side at the same level, at the level of umbilicus, because it is a bilateral case. So we are giving this sort of ports. In case of unilateral, we can give both ports on the left side for right-sided undescended testis or inguinal hernia. Okay, so now we are going for dissection. First, we will coagulate the gubernaculum. Jafrul, I think screen view is lost, or is it okay? You can see the both screens, right?
না স্যার, দুইটা তো দেখা যাচ্ছে
Jaf-
স্যার।
Okay, that is okay.
দুইটা স্ক্রিনই আছে।
So, this is not a problem. Problem could be with this length. I think if we go through it, it will reach the upper part of the. I think we will be getting some length, no problem. So while coagulating and dividing this gubernaculum, keep in mind that the vas does not go into the damage. Okay, you see, you always look for vas that it is not caught. একটু সময় নাই আর কি. So you can follow, right, Jafrul?
Yes, sir. Yes, sir.
Okay. You see, the vas is away from our cautery side. I am using bipolar initially so that there is minimal chance of bleeding. Any bleeding during this operation will take আরে ওই ভাল্ব সরাও তোমরা কি আমি বললাম এসি ঠান্ডা করতে গরম করে দিলা তো okay so we are now dividing gubernaculum right
Yes, sir.
gubernaculum is divided now we will divide the peritoneum in this part keeping a bit away from the testicular vessels and use the tip of the hook and catch very little of the tissue at a time and in this side we will also this is the vas so we will try to keep away from the vas so that the vas itself and the vasal vessels are not coagulated right now in this area the little flimsy fibrofatty tissues you see the vas is lax okay the vessel is a bit taut before going there we will finish this division of the peritoneum in the deep inguinal ring so that there is no minimization of the chance of inguinal hernia development in this side through the right side okay so this is one option of treating inguinal hernia or minimizing the chances of developing inguinal so circumference is the peritoneum is divided now what we will do is we will divide the peritoneum over here so that vessels will be released in a pull away from the vessels so that only the peritoneum is incised. You see, I think the peritoneum is incised adequately. Few fibers here we are dividing. You are still with us, right,
Yes, sir.
Jafrul?
Yes, sir.
I think our dissection is all, complete. What we will do now is this is the inferior epigastric vessels. So we will create a window here. we will introduce the Maryland through the right-sided port to create a tunnel, and always keeping the inferior epigastric vessels safe. Who is it? Salman? So you see, we are in the scrotum with the Maryland. We will divide the give an incision on the skin here. Bring out the tip of the Maryland through the incision. We will introduce a tissue forceps in a railroading manner. Through this hole. Before that, we will try to enlarge the hole in the scrotum where the Maryland came out, so that the tissue forceps goes easily inside. Otherwise, it will be stuck here. Just trying to make things easier. You see, the tissue forceps is inside, right? Can you see, Jafrul?
Yes, sir.
Now we will put the testes, not testes, we will hold the divided gubernaculum. Now we won't try to hold the testes. So you see the divided gubernaculum, which will not damage anything. Okay,
Yes, sir.
and from inside we will try to enlarge the opening a little so that the testis does not get stuck here. আগে চেক করবা তুমি, 1 ঘন্টা আগে এসে আমার লাভ কি? এটা যে ঢুকে গেল সেটাও তো আমাকে বলতে হইতো, এটা যে বাইরে হয়ে যাচ্ছে। So trying to just enlarge the opening. To accommodate the testis properly. I think we have done what is possible, at least for us. And while pulling, you see, try not to twist here. Little, you see from outside, Jafrul, can you see outside?
Yes, sir.
See outside now,
Yes, sir.
right? This is the testis, you see?
Yes, sir.
Jafrul, can you see?
Yes, sir. দেখতে পাচ্ছি, স্যার।
You see?
দেখতে পাচ্ছি,
And
স্যার।
from inside, it is okay, right? So not so
Yes, sir.
much tension. You see, adequately came here and kept here. We will now fix
Yes,
it
sir.
first, then go for opposite side, right?
Yes, sir.
So you are happy with the right-sided orchiopexy,
Yes, sir.
Jafrur?
Yes, sir.
Who
স্যার আমার
else
কথা
is
শুনতে
there?
পাচ্ছেন স্যার? স্যার আমার কথা কি শুনতে পাচ্ছেন স্যার?
A bit low voice, but I can hear you. But you should find out what is the problem. If you can hear me clearly, I should also hear you clearly. For the past few weeks, it is I cannot hear you properly. Check your mic. If you are talking through the mic